we are reporting 33 new cases of COVID-19 in the state. This includes 15 new hospitalizations. We have no new deaths to report. We have 59 new individuals who have recovered from COVID-19, and we have an additional 68 new negative tests that have been performed. In total, we have 2,245 COVID-19 cases in the state. This does include 150 hospitalizations and 11 deaths. Total, there are 1,316 recovered individuals and 14,130 negative tests that have been performed. The new cases have occurred by county in 1 in Brookings, 1 in Douglas, 3 in Lincoln, 26 in Minnehaha, 1 in Stanley, and 1 in Yankton. For a breakdown by age range for these cases, we have 5 in the 0 to 19-year age category, 6 in the 20 to 29-year age category, 13 in the 30 to 39-year age category, 5 in the 40 to 49-year age category, 6 in the 50 to 59-year age category, 5 in the 60 to 69-year age category, and 3 in the 70 to 79-year age category. Did I say 13? Excuse me. Going back, 3 in the 30 to 39-year age category. Apologies if my tongue got ahead of me. For the new cases by sex, we have 16 in males and 17 females that are cases today.
With that, we'll open it up for the first question.
Yeah, Gordon Richard with the Alcester Union Hut tonight. Is the Smithfield numbers with the once they infect, is that progressing as anticipated?
I mean, we would anticipate that individuals would be fewer and fewer cases kind of over time. That's both a factor of both any potential transmission events that were occurring in the workplace, as well as any other potentially susceptible populations that may have been exposed through other routes, including within the community. So, we do anticipate that our total cases associated with Smithfield, to be decreasing over time as we have in any other sort of cluster that we have in the state.
And St. Paul, Dakota Broadcasting.
Go ahead. Public Broadcasting.
I was wondering, here in Aberdeen, the City Council is going to be considering an amendment to the local ordinance, which, kind of puts a halt to business at this time because, according to our mayor, our projection rate for hospitalization, I think, was 25%, now down to 6%, and the whole reason we were locking out business was to flatten that curve and not exhaust hospital resources. Does the Department of Health have an opinion as to whether or not we are in a location where we can start, I guess, going back to business?
This is Kim Olson-Reisden. I guess what I would just say, I haven't seen what you're referencing relative to what Aberdeen, the Aberdeen City is looking at for their ordinance. We do continue to revise our projections as we get more data that's specific to how South Dakotans are experiencing the COVID disease, and we will continue to update that model. You may be aware that we've seen a decrease in our projected number of hospital bed needs based on how we are experiencing the disease, so that's been good news. The other thing I would just reiterate is that the projections that we are doing are for the purposes of preparing for hospital demand so that we don't overwhelm our healthcare system. So to the degree that others are doing projections with that in mind, that has been the approach that the state has used as well.
This is Morgan.
Go ahead, Morgan.
Can you hear me?
Yes, sorry, go ahead.
Yep. So a Yankton doctor wrote in the Washington Post earlier today even that he had a patient who died of respiratory problems, but he thinks that her coronavirus test was a false negative. So is there any, or has there ever been any concern for false negatives in South Dakota?
Obviously, individuals who have a test and that test is not appropriate to their actual condition would be an area of concern. It's not something that we've typically seen as a large service in the state. What I know is that there are a bunch of different testing methods that are out there, and the majority of those are able to, if a specimen is processed correctly, be able to differentiate a person who has active infection with COVID-19 from an individual who does not infected with COVID-19. So, I'm not sure the specifics of this case, but it's something that would be of interest, for us to know, why the individual physician did believe that was the case. But I think in general, if you have is concerned about their patient, there are a lot of ways that a suboptimal specimen may be collected, and that may play into the overall belief of the physician. So I think that any sort of false negatives, whether that's on correctly due to testing or due to specimen collection, is a concern.
And just a follow-up, if there was any false negatives going on, how would the state go back and update their information to reflect case?
Well, so that would be something that the clinician would do additional testing to identify whether the person, as their symptoms would progress, they would likely do an additional test to identify, based on their clinical reasoning, and appropriately do any additional testing. So that specimen, when it came back positive, would then come to us at the public health laboratory. The other thing to keep in mind is that an individual that tests negative one time and then tests positive another time is not solely going to be due to a false negative result from the testing. That may also be due to an individual who has developed, has been exposed to COVID-19, and the previous test did not identify either during their illness, because the virus was still incubating and the specimen was not able to have enough virus be below detectable limits. And so there are multiple reasons why a person tests negative at first and then may test positive later on, and that's not necessarily a false negative result.
Okay, thanks.
Thanks, Morgan.
Next
Next
question.
question.
News Radio, could you give us an update on how the work is going to resolve the problems with the Care19 app for Android phones?
Sure, this is Kim Alston-Risden. We got word that there were some issues with, I think, how the app was capturing location data. One thing that we will be encouraging people to do is make sure that they're loading any updates to the application, because there have been some updates, just like with any software application, I would guess, to further refine it. And I understand that at least one of those updates is to get at the problem that you're describing there.
Thank you.
You're welcome.
This is Mark from the Black Hills here.
Go ahead, Mark.
Two questions for you. When people are tested, their test comes back positive. How is their county of record recorded? Is it with their permanent address or is it with a temporary address? And then secondly, we've heard probably on social media that if somebody dies of a stroke, for example, yet they still test positive for COVID, then that is considered a COVID death. Can you speak to that at all?
Sure. So the first question around the address of an individual, that is based on the permanent address or the resident address for that individual. Temporary addresses, a person who might be just traveling through the area or is living temporarily in a specific area, that typically would not be part of the count for a specific county. Areas that may not be necessarily the case is if the individual is being actively managed by the South Dakota Department of Health. So we've done all the follow-up. That person has not returned to their county of residence. Those cases in some of those situations would be counted as a part of our case counts overall. So the second question around stroke, that yes, an individual who develops illness and dies from that illness that is may or may not be directly related to COVID-19. So it is really based on the clinical knowledge of the person's illness in terms of whether or not the most proximal cause of death or that the underlying cause of death is actually related to their COVID-19 diagnosis. So that is made kind of on that individual level, and that is information that that we have access to for all individuals who who die in South Dakota and have a positive laboratory test, as well as individuals who die and there is no specimen that's collected, but it's the illness is believed to be due to COVID-19. That it really is based on how the clinician is feeling that the COVID-19 specifically relates to the death.
So if I might, this is Kim, I might just clarify. So if a person dies of a stroke, but there's a secondary cause related to COVID, it would be recorded as a COVID death. Is that right, Josh?
Correct.
Okay.
If the stroke, then it would not.
Okay, next question.
This is Lisa with Liddy at the AT.
Go ahead, Associated Press.
Just wondering if you have an update on Smithfield numbers, both new cases and overall, both for employees and their associates.
So as of today, we have 850 COVID-19 cases among Smithfield employees. This does also include 245 close contacts that have themselves become cases.
I'm not sure who else was trying to ask this a question at the same time the Associated Press was. Whoever that was, please go.
This is Lisa Ray from Killand.
Lisa?
Yeah, just wondering, I noticed there wasn't an increase in cases in Brown County where the Demcota beef plant is. Just wondering if you're still concerned that those cases could be going up.
So we have expanded our surveillance for Demcota, and so any individual who is showing COVID-like symptoms is able to get tested, and so I feel like the numbers that are shown today, which are 0 for Brown County, are reflective of actual events on the ground.
Okay.
Hi, this is Ray from Kellerland. Can you
Go
hear me?
ahead.
I just want to go back to Smithfield. 850 employees includes 245 close contacts. I want to make sure 850 is employees, 245 is close contacts. You've been separating them before. And
Yeah. So it is 850 850 of our COVID-19 cases are among those Smithfield employees. There are an additional 245 close contacts to those Smithfield employees that are now cases.
Okay, just wanted to make sure because there was an include. Thank you.
Yep.
Thanks, Ray.
This,
We'll take one more question.
Carol Eggers with NBC News. Do you have numbers for the age of those close contacts? How many of those are in the 0 to 19 age category?
We have, don't have the data broken out like that, and that's not something that we would provide. We do provide overall individuals who are close contacts, though. So that's that 245 number.
Okay. Thanks, everyone.